Good afternoon, everyone. My name is Shikha Gupta, and I'm an analyst working with the social determinants of health section at the Center for Population Health Data at StatCan. It is my pleasure to present today on Statistics Canada Health Data Holdings. In my presentation, I will be talking about three types of data that we have to support research and analysis. The first is the survey health data, and I will take you through the major health surveys that we have. The second type of data is administrative health data that comes from government agencies and private sector organizations as part of their ongoing operations. The third in the list is the integrated health data, which combines the above two categories and provide a rich source of information. Before I start introducing the data sources, I would like to talk about the Centre for Population Health Data. So, as you all know, Statistics Canada produces statistics that help Canadians better understand their country, its population, resources, economy, society, and culture. CPHD is the part of StatCan that makes available information on health of the population, their lifestyle, and the environmental factors affecting health, access to health, or use of healthcare services, and research into these topics. The available health data comes from a variety of sources that I will discuss here. So let's discuss the survey data first. The first and most relevant probably for this group is the Canadian Health Survey on Children and Youth. This survey explores issues that have an impact on the physical and mental health of children and youth, such as physical activity, the use of electronic devices, time spent in school, and extracurricular activities. The survey covers three 5-year age groups from 1 till 17 years of age. The data from this survey are available from 2019, which includes around 48,000 respondents across Canada. This survey also includes information on individual postal codes, census geographical areas, as well as health regions to apply some geographical lens to the analysis. The last survey on children and youth was released in July in 2020. So this is an example of a recent release by StatCan that used the Canadian Health Survey on Children and Youth and explored that how many children in Canada experience the separation or divorce of their parents. One of the other major health surveys that we have is the Canadian Community Health Survey. CCHS is a cross-sectional survey that collects information about the health behaviors, and healthcare use of the non-institutionalized household population in Canada who is above 12 years of age. CCHS has three components: an annual component, which happens at regular 2-year intervals, a focused component, and then some special components that occur depending on the project and the subject matter. The purpose of the annual component is to do health surveillance, and some of its content includes socio-demographic information, height and weight, food consumption, physical activity, healthcare use, chronic conditions, and exposure to smoke. The objectives of the focused or special components of the CCHS are to examine a single topic or population in considerable detail, such as mental health and well-being, nutrition, and aging. An example for a special project is Survey on Living with Chronic Diseases in Canada as a follow-up to the CCHS annual component. The CCHS was initialized in 2000 and has 20 years of data available covering around 65,000 respondents per year. In terms of geography, the CCHS collects information at the sub-provincial levels, which include information on individual postal codes, census geographical areas, as well as health regions. So this is an example of a study that was published by StatCan using the CCHS to provide the portrait of youth in Canada in terms of their physical health and behaviors. This particular release was dated February 1st, 2021. Another major survey that we have is the Canadian Health Measure Survey. CHMS is an ongoing national health survey that is designed to collect information on important health issues that cannot be collected through self reports and cannot be monitored without direct measures such as metabolic syndrome, environmental toxins, and physical activity. The CHMS complements existing health data sources like CCHS by conducting direct physical measures of Canadians' health in a mobile examination center. CHMS has four components: the household component, the mobile clinic component, a laboratory component, and a biobank component. The biobank component is used for the storage of whole blood, plasma, serum, urine, and DNA for future health research. Cycle 1 of CHMS covers those individuals between 6 and 79 years. The new cycle might be pilot testing down to 1 year of age. CHMS includes information on individual postal codes and census geographical areas for 10 provinces in Canada. Just to note here that the mobile examination component part of the CHMS was on hold due to COVID, but may be restarting collecting this year in 2022. Here are some examples of the common physical health measures that are undertaken with CHMS, including urine collection, spirometry, anthropometry, and phlebotomy. CHMS also collects information on indoor air quality to analyze the environmental exposure. So this is an example of a recent study published in Health Reports by StatCan analysts that explored the prescription medication use among Canadian children and youth using the Canadian Health Measures Survey. This was also released in March of 2021. Moving on to some of our administrative data sources. So vital statistics are produced from civil registrations of births, deaths, stillbirths, and are the basis of some of the most meaningful health and demographic indicators, including population estimates, life expectancy, infant mortality, leading causes of death, fertility and mortality rates, and cancer survival estimates. Other commonly used administrative data is hospital records such as discharge abstract database and National Ambulatory Care Report System. Please note that CPHT is not the primary custodian of these data sources, but shares it under the common sharing agreement with the Canadian Institutes of Health Information, also known as CIHI. I will broadly mention about these sources later in my presentation. So the first is the Canadian Vital Statistics Birth Database, which collects birth records since 1974 and includes around 385,000 records per year. This database contains information on characteristics of infant, such as date of birth, sex, birth weight, and number of weeks of gestation. It also includes the characteristics of mother, including their date of birth, age, birthplace, postal code, marital status, total number of children born or stillborn in the event, or multiple birth order or place of birth. The 2020 Vital Statistics birth records have been released and must be available to researchers very soon. The Canadian Vital Statistics Death Database collects demographic and medical information annually and monthly from all provincial and territorial vital statistics registries on all deaths in Canada. The data includes information on age and sex, marital status, place of residence, and birthplace of the deceased, the date of death, and the province or territory of occurrence of death. It also collects information on the underlying causes of death, classified according to the World Health Organization's International Statistical Classification of Disease and related health problems. These data are used to calculate basic indicators such as counts and rates on deaths of residents of Canada. Information from this database is also used in the calculation of cause-specific and age-standardized death rates, as well as life expectancy. The next is the Canadian Cancer Registry. The Canadian Cancer Registry is a population based registry that includes data collected and reported to StatScan by each province or territorial cancer registry. The person based CCR collects information about each new primary cancer diagnosed among Canadian residents since 1992. So far, over 2.7 million cancer cases have been recorded in the Canadian Cancer Registry. All cases are coded according to ICD-03 third edition. The data describes both the individual with the cancer as well as the characteristics of the cancer itself. The patient records include demographic and mortality information, while tumor records contain information about the characteristics of the tumor and its diagnosis. So as I said, I would also like to mention about other commonly used administrative data sources that are not solely owned by Statistics Canada, but used very frequently. And the two most common sources of hospital-related data are the DAD and NACHRS, the Discharge Abstract Database, which captures the administrative, clinical, and demographic information on hospital discharges from all provinces in Canada, as well as territories except Quebec. Whereas the National Ambulatory Care Reporting System contains data for all hospital-based and community-based ambulatory care. The database includes information on day surgeries, outpatient and community-based clinics, and emergency department visits. The other one is the Ontario Mental Health Reporting System, also known as OMERS. The OMERS include information about mental and physical health, social supports, service use, as well as care planning, outcome measurement, quality improvement, and case miss funding applications related to the individuals receiving adult mental health care services in Ontario, as well as some individuals receiving services in youth inpatient beds in selected facilities in other provinces. The other most frequently used data source is the T1 family files, also known as TIFF. The TIFF mandate is to produce the income estimates at the lowest levels of geography. The majority of the information available on TIFF comes from the Canada Revenue Agency. The population of the TIFF is tax filers, their spouses or common law partners, and their dependents. It also contains both the tax filers and imputed records. Various variables that have been pre-calculated contain family information, such as family size, family total income, families after-tax income, and family composition, as well as their geography. Overall, TIFF provides a rich source of data to analyze the concepts related to income, employment, social benefits, social assistance, pension, etc. The other one is the Longitudinal Immigration Database, also known as IMDb, which is a comprehensive source of data that plays a key role in understanding the economic behavior of immigrants to Canada. It is the only annual Canadian dataset that allows users to study the characteristics of immigrants to Canada at the time of admission and their economic outcomes and regional mobility over a time span for more than 35 years. IMDb brings together immigration information from the Immigration, Refugees and Citizenship Canada, also known as IRCC. It brings taxation data from the Canada Revenue Agency and the death data from the Canadian Mortality Database. Moving on to the third type of our data holdings, that is the integrated health data. So what is integrated health data? When multiple data sources are linked together and integrated, the resulting insights can provide a more complete picture of the impacts of social determinants or health behaviors on health outcomes. Also to know that integrated health data can be more than just integrating survey to administrative data, but can also include admin to admin linkages or linking survey to survey data. Integrated health data can be further divided into two forms based on the type of linkage. The first is individual record linkage and the other one is area-based linkage. Today, I'll be particularly presenting on some of the individual level linkages related to the children and youth health. The example of the first type of individual linkage is scan check, the Canadian Census Health and Environmental Cohorts. The Canadian Census Health and Environmental Cohorts are population-based linked datasets that combine long-form census respondents with administrative health data such as mortality, cancer, hospitalizations, ambulatory care, as well as the annual mailing address through postal codes. These data can be used to examine health outcomes by population characteristics such as income, education, occupation, language, ethnicity, immigration status, or indigenous identity. The CanCheck 2016 is ready for the release to include the 2020 death data along with the DAD and NACers, the Ontario Mental Health Reporting System, and the historical postal codes. This is an example of a study that used the CanCheck data to find age-specific suicide rates among First Nation males living on reserve and the non-Indigenous males aged 1 year and older. Similar to the CanCheck, we have several integrated datasets involving the CCHS. The purpose of this record linkage projects is to create an integrated dataset that allow researchers to analyze the behavioral, socio-economic, and environmental factors along with the use of hospital services and health outcomes at the population level using the CCHS annual or focus content surveys. One example that I'm showing here is the CCHS multi-linkage project, which is available in the RDCs. This is an example of a project where survey data is linked to another survey and admin data is linked to another admin sources. This integrated data set facilitates the study of the impact of a broad range of social determinants of health on a variety of health outcomes at the population level. The tax data for the individual as well as different family members are also included on this to analyze the change of income over a period of time and assess the economic impact of health conditions on the population as they age. Similar to this, there are data sets that have been created by linking various admin data sources only, such as linking the discharge abstract database with the National Ambulatory Care Reporting System and the Ontario Mental Health Reporting System to the Canadian Vital Statistics Death Database. Again, an example where data from the CCHS, a big survey, was linked to the Canadian census. This study reports the prevalence and inequities in mental health outcomes, such as self-reported poor mental health, life stress, and physician-diagnosed self-reported mood and anxiety disorders at the city, provincial, and national levels over a period of time. The other linked data set that we have is called CAN-BCC, the Canadian Birth Census Cohorts of 1996 and 2006. The purpose of CAN-BCC database is to provide information on the nature and extent of variations in perinatal health across socioeconomic and ethnocultural groups. It is population-based data with a large sample and a cohort weight that permits inference about the population of births that the cohort represents. This allows for detailed analysis of perinatal outcomes by characteristics including education, income, ethnicity, and aboriginal identity of the parents. A cohort of births up to 2 years prior to the census date are created by linking Canadian birth and infant death registration data with a 20% sample completing the Canadian census long form. Another important linkage that we have is called mother-centric linkages. This linkage has been created in the social data linkage environment, where a cohort of mothers were created using information from the Canadian Vital Statistics Birth Database and the Canadian Vital Statistics Stillbirth Database. This particular cohort identified each mother and linked it with all of her babies. The mother file was then linked to the data from the immigration and hospitalization sources, which provided rich information about the immigration and health service utilization to the mother file, their education status, the income, and the outcomes such as hospital admission and discharge. This data integration also provided the first comprehensive longitudinal database of mothers and infants in Canada, which significantly expands the analytical capacity. This is an example of a research using the Canadian birth census cohorts. So in this example, the authors used the 1996 and 2006 CAN BCC and estimated the risk ratios and risk differences of preterm birth, small for gestational age, large for gestational age, stillbirths, and infant mortality rate between the foreign born and Canadian born mothers. So how can you access the various data that I spoke about today? Many of the integrated data sets are available to users through the Canadian Research Data Centre network. The Statistics Canada website provides the information you need, including which data are currently available in the research data centers and how to apply for access to these data, as well as a list of approved projects within the last 12 months that are using a particular data. This is an example where a list of all RDC projects within the last 12 months can be found on the StatCan website, along with the contract title, the principal investigator, and which data cycles this particular project is using. You can also find a complete list of surveys and statistical programs by subject area at a StatCan website. For example, the link provided on the slide provides you the information on Canada's infants, children, teens, adolescents, students, and young adults. Various topic areas include childcare arrangements, the crime, the education, health, immigration, risk behaviors and violence related to the children and youth. You can also take a look at the full list of active surveys that are going on through Statistics Canada, as well as full list of inactive surveys that were collected a while ago. At the StatCan website, you can also take a look at all the approved microdata linkages, which is a list of all the submissions that have been reviewed and approved in accordance with the Statistics Canada Directive on Microdata Linkage. And that's all from me. If you would like more information about our data holdings, you can email StatScan at the address you see on the screen. And I will be also happy to follow up with any questions that you can send to me on my email address. Thank you.
Thank you, Dr. Gupta. I'll open the floor to some questions. Maybe I'll start. Can you just let us know a little bit about who most of the users of your data are? Like you listed the projects. Is it usually investigators? Is it a lot of trainees, students doing projects? Who have been the main users of these of these data holdings?
Sure. So, as you said, based on my own experience, I've seen the investigators from across Canada and mostly the academic researchers requesting for the access to various data sources provided by StatCan. And then they have a network of students and trainees who work with them on a variety of data sources. I personally, when I used a StatCan source outside, when I was not in the StatCan, there are many organizations, for example, the service provider organizations that have great interest in our data holdings, and they can also request to access the variety of data. Maybe my colleagues Nicole or Yubin would like to add.
I guess the only thing I would add to that is we also work very closely with the provinces and the territories, as well as with the other federal organizations like the
Nicole,
Public Health Agency of Canada and Health Canada, who owns these data.
thank you. I have a question. I think I have Astrid and then Teresa. Go ahead, Dr. Gutman.
Oh, thank you, Dr. Cohen. I have a few, thanks for a really interesting presentation. I have a few questions, particularly around the linked survey to administrative data. I assume, and this is just not my area, but the sample weights that you use normally when you're analyzing survey data only, are there sort of other considerations around those weights when the samples are then linked to administrative data?
Yes, yes. For example, in the CAN check data that I mentioned in the presentation, we have different weights to account for the population, different sample sizes. I have my colleague Hubin here, who is an expert on the linked data and has been working on the integrated data sets for quite a number of years, and he would be able to add more to that.
Thanks, Shikha. Yeah, thanks for that great question. So one thing to come across is that's probably the most costly activity, essentially, to take on a project. So we do the adjusting and calibration of the original sampling weights, as well as the bootstrap weights or the other replicate-based weights to account for those respondents who didn't link to the particular data set or our registry. But those adjusted sampling weights are not available for all survey that has been sort of undertaken for different projects. So primary example that we have that are sort of a good quality will be the CAN check that Shikha has mentioned. But the multi-CCH linkage that Shikha has also presented, so those have the adjusted sampling weight as well as the replicates or bootstrap weights. But linkages like the CHMS that's been linked, those sampling weights hasn't been adjusted for because there was no funding to do those type of activities. But if you have any other follow-up questions to that, I'll be happy to answer.
Yeah, it's interesting. I do, Al, can I just do one more follow-up question?
Yeah,
It was actually a general question too about linkage, because you know, a big part of like reporting, you know, data using linked data really is around the linkage rates and the, you know, knowing something about the biases that might be introduced because of issues around linkage. So are those kind of, is that generally available? Like, do you have a good, like, it sounds like for survey data that gets incorporated into the way the weights are used, if you're lucky enough to be using a survey where that's been done. But then for the other data sets, is there also a way to sort of understand, you know, some of the unlinked, like, and what some of the biases are?
Yes, yes, definitely. Thanks for the question. And so all the data sets that are available in the research data centers across Canada come along with the documentation on those data sets or integrated data sources. And all the limitations as well as strengths of that data are provided in the documentation, including the details on the weights as well as the sampling strategy and how the linkages were done and how successful the linkage was or was not. So every limitation of that data set is provided in the documentation along with the data set that you would need for your project.
Great, thanks.
Teresa.
Yes, thank you. if I have a couple of questions, but if I may also follow up on Dr. Gutman's question, I think that's an excellent question. We all sort of struggle, when we use health survey data, especially the integrated one linked survey, we all struggle with the weight, which one is the most proper weight to apply. So if I may, just share some of my own experience using weight when I use the CCHS linked data. I think, correct me if I'm wrong, if you use the entire survey population, then the weight, whether it is the survey weight, the sampling weight, or the bootstrap weight that you've been talked about, it's fine if you're using the entire population. But a lot of us actually select a sub population. Like, my research, I'm particularly interested in people self-reported asthma or people who self-reported using cannabis. So they are not really selected based on the survey design. So none of the weights is actually proper. So most researchers, I come through published articles, most researchers, when they do that, they apply no weight. So because the weight would fail, it doesn't work. So when you sample a subsample within a survey, then using weight actually would give you more bias than anything else. So most people would resort not to weight the analysis at all. So that's one comment, just to follow up with Dr. Gutman's excellent question. So let me go into my own questions. Also slightly related to data linkage. You talked about linking to the usual health admin data like NACOS and DAD. So one follow-up question is there any national physicians claims data that would allow for linkage? I think that's one bucket that is hugely missing. Right now, we are not able to link to outpatient claims data. So that's one question. And also, there are other databases or indices that we all use when we look at health administrative data usage. One index, for example, is the Canadian Marginalization Index. Right now, when we need to use that in our analysis, we have to bring it in. We have to request a specific linkage at Stats Canada. So I wonder, if you have any plan to just integrate that, because that is a very commonly used, index. So that's one request. And my last question is the Children's Health Survey, or the Canadian Health Survey in Children and Youth. That's is a cross-sectional survey. I know that years ago we have a national longitudinal survey in children and youth. It's also a cross-sectional, but it has a built-in longitudinal component. Is that all gone, or is there any plan to build a longitudinal component within a cross-sectional survey on children? I think that is so important. I know that is very expensive, but it's so important to have a longitudinal component. You don't need to do the entire national cohort, but at least have a subcomponent. I think that would be hugely useful for many of us. So I'm going to stop there. Thank you.
Thank you, Dr. Gordon, for your wonderful insights and questions. I'm not an expert to answer all of your questions, but I'll try my best based on my own understanding so far. So I am aware that there is a longitudinal survey on children and youth that used to be in the field a few years ago, and it is no longer being collected. But the data that from the that was collected in the previous cycles is available upon request. So that's not the most recent data, but whatever we have is available upon request through the RDCs. And I'm not 100% sure if they are going to do the longitudinal survey on children and youth again, to be honest. Your second question was on the Canadian Marginalization Index. Correct me if I'm wrong, Eubin or Nicole, but this index can also be requested through RDCs and can be linked to a variety of sources such as census, because our team has done some analysis using that. So I think that would be possible again through RDCs. And your third question was around the outpatient claims data, and I'm not aware of any such administrative data sources being linked to other data sources that we have, and I have to explore on that and get back to you if I can. Maybe I'll invite Eubin or Nicole to add on to that.
Sure. I can add to the discussion around the deprivation index. So Shikha is absolutely correct. It's possible to bring in like area-based, like any type of area-based measure, similar to the deprivation index or the deprivation index into the RDCs for you yourself or your analyst to incorporate with data that's already existing in the RDC that you have approval to use. Additionally, there was, I think, a CCHS annual file where they pilot tested including it on the data file, including the public use, the pump file. I'd have to follow up on that to verify, but I think they did test it as something incorporated, at least with the Canadian Community Health Survey release data, though I don't believe that it's ongoing. So I don't think the pilot was successful in creating value that that people were looking for. I do believe it becomes more effective when you can integrate it with the micro data within your own data holdings within the RDC or amongst your own data holdings that you're using for your analysis. Yeah, I would also confirm what Shikha says about the plans about longitudinal data. Longitudinal data is absolutely a data gap that everybody within StatCan is well aware of. Unfortunately, at this moment, there isn't a plan for creating a longitudinal data that we have approval for at this moment, but it's certainly a need that everybody is aware of. And I don't, Eubin, do you know anything about outpatient claims data source holdings in linkage?
So that, as well as I think physician billing is another database that Teresa had inquired. So those are not part of our StatCan data holdings with the sharing with the CIHI, but there has been discussion back and forth in terms of the data quality and what coverage can be sort of shared with StatCan and subsequently used for integration purposes, but they are still work in progress. As for some of the other comments were in terms of bringing any type of indices. So I've had this discussion with another researcher at McGill University recently. So at the time of submitting your research proposal through the microdata access portal, let's say if you're to access those through the RDC, you could actually list those indices at the very beginning. And then we can have that incorporated for your particular project, as opposed to you bring it separately at the time you're accessing the data. But I don't think there's a standard protocol to integrate for every data set per se. And I do completely agree about the analyzing subpopulations and how using sample weights can be challenging. So I think a lot of the time our recommendation on our user guides are that you either take the cohort approach, and which are the typical cases that you had stated, or the population approach, which will be based on, using the entire respondent population and for which the sampling weights were adjusted for. And I think the problem is the inappropriate stratification instrument variables that were used to calibrate those weights, because they don't account for these particular subpopulation. And I do agree with that challenges and analytical capacity to that too. So
there's quite a few other questions. Let's try to get through some. I'm going to do one from the chat, and then I know there's a couple of people waiting with their hands up. There's a question. It looks like the CAN CHEC data is available in the RDCs only up to 2011. Are there plans to have linkages to more recent census data?
Yes. So although
I just posted that chat.
yes, Nicole has provided an answer in the chat, and she's absolutely right that CanCheck 2016 is in the RDC, but it only includes death data up to 2019. We are planning to do another release on CanCheck 2016 that will include the updated death data and cover the deaths that happened in 2020. It would also be integrated with the data from DAD and NACAs, as well as the OMERS.
Thank you. I see two questions. The first one, Gordon Cleland.
Yes, thanks very much for your very helpful presentation, Dr. Gupta. My research area is in early childhood education, childcare, and I know the federal government is spending $30 billion over the next number of years and has signed agreements with all the provinces and territories. Nearly all of those agreements commit those provinces and territories to an immense amount of data collection and an immense amount of sharing of that data with the federal government. So I'm trying to really ask whether or not proactively the center, your center, or somewhere else in StatCan would reach out to try and make this data available and link it. Like it seems to me that would be an immensely useful source of linkage of data with health surveys going forward. And it would be good to sort of grasp that opportunity. So I'm really raising that as an issue for discussion.
Thank you, Dr. Gordon. That's a very, very important question, and thank you for bringing that up. I'm not sure myself that there is a survey that's planned to collect that information, or that would already include information and get that linked to another database. We do have a section in our center that plan new surveys and make those decisions. So I can confirm that on your behalf and get back to you if I have any good news in that direction.
Thanks.
Anything that you would like to add, Nicole?
Yeah, I'll add to that. Really, the lead about the childcare and education and the connection to health would be Leanne, who I do believe that Leanne Finley, who's part of this group from Statistics Canada. She is the lead at StatCan on all of those components, and I can tell you that there is tight cooperation between Employment and Social Development Canada with Statistics Canada on the data development and the data holdings around that particular topic for sure. I'm not sure what the data linkage situation is in that area. But speaking with Leanne, I'm not sure if she's on this call. Leanne would be the most relevant person to have that conversation with.
I just wanted to jump in. This is Leanne Finley, and yes, I am on the call. I was having some technical difficulties, but I am on the telephone, and I just, I guess I could address Gordon's comment in saying one of the issues would be that, there's no known information yet on whether that will be held, so data will be held by the provinces, as you know, or whether it will be come to the federal government in microdata form, or whether it'll just be reports. So that part is all being worked out. If it came into our environment, then certainly, we could explore the possibilities of linkage with other information, which would be very useful. Of course, the hard part would be, the information is going to come in at the level of, the childcare information is primarily coming in at the business level. So it would be, what would be the possible linkages with other business level information as opposed to child level information. But, I think it's an excellent point for future exploration.
Thank you for that. I think we have Daphne Cohen. I see your hand is up.
Sorry, just to follow up on Gordon and Leanne's points, it's particularly important in the area of child research, because for a lot of the child care things that ESDC is collecting information on, they've kind of ignored child outcomes. So when we see that their child outcome data in other data sets, it seems like it's, a no-brainer. But things aren't always that easy, nor do they always line up. And we know when it comes to the child data, especially for the surveys, things are a little thin and kind of dragging along. So we hope that situation will improve to fill those information gaps. But I had comments about some of the other things that were raised. So I'll just maybe go in the order that they were raised. So the first, is a really good question about all these linkages. If you want to know the details, Statistics Canada, as we said, produces very detailed methodological reports, sometimes more than you need or want, but particularly to state the limitations of who's in and who's out when those linkages happen. So that is available, but for some of you who may want a shortcut, once papers have been published using those particular linked data sets, you could just look at those papers for the methods and the limitations to give you a bit of a shortcut. For example, to identify if a province is left out or the territories weren't included or whatever that is. And in terms of, the weighting question, I think that is the most challenging topic. It has been for a very long time for researchers and analysts to get their heads around. And, sometimes the weights don't need to be used. So the two main reasons for the weights are, one, to maintain the representative properties of the sample, which is often, our goal at Statistics Canada, but also it's to adjust for the complex survey design that's sometimes clustered or whatever it is. But we've had other cases where we link external data sets, for example, to administrative data, where it doesn't need to be weighted because they're not necessarily looking to be representative of an entire population. So, be mindful. And often when we do use the weights, we're just being more conservative in our estimates, and so it's kind of like an added protection, but it doesn't always have to be used. And please reach out to StatCan methodologists or others if you have questions, and we'd be happy to provide you with information to better be able to understand those. Especially with these linked data sets, it gets complicated very, very quickly. Okay, the only other thing I wanted to talk about was longitudinal data for kids. So, a lot of us are used to thinking of the traditional longitudinal surveys where you're following kids and re-administering the surveys to the families. And, there's a huge issue with response rates now and the length of surveys and the demands being placed on respondents to fill out questionnaires from, lots of places. And so don't forget, the whole point of these linkage activities is you could actually follow people forward in time. For example, with the NLSCY, they've done linkages to tax. So even though we're not collecting data on those children and families, we do have information that follows them forward through adulthood, for example. So, this is part of the point of showing these linkages, that there are ways to look at events over time by using these administrative files. Thank you for the presentation. It was great. Great overview, even for someone who knows the data sets.
Thank you.
Thanks, Daphne. There is, I think, a question. I'm just trying to navigate everything in the text box. There's another question from Teresa Toe about, I don't know if this is the right group to answer it, about whether there may be an opportunity to work remotely on data rather than just at the RDC. Is there any plan at StatCan to create a virtual platform that's secure for data access?
So there is a a pilot program running right now, which I believe is being called the Virtual Data Lab, where StatCan is developing basically like a virtual RDC that would allow people to create a secure network and have access to similar type data that is available in the RDC. At this time, only certain data is available within this program because it has to be of a certain security level, basically. So the data that is available is limited. However, Teresa asked specifically about whether or not linked data would be available. It would be, at this time, linked data would be available, but both data sources or all the data sources included in the linkage would have to be of the minimum security level necessary to be appropriate within the virtual data lab. But at this time, the organization is testing a bunch of different ways to try to open up more data sources for availability through this option. So stay tuned. That might be another presentation to bring out to your group because there are lots of very exciting and innovative advancements happening in the data access world that way. So if this is a presentation that you folks are interested in, we can connect you with the group at StatCan who would be best to speak to you about that.
Yes, please.
Are there any other questions? I think there's a bunch of other comments in the chat box, but I don't think they're questions. So I encourage everyone to have a look at them. But just wondering if there are any final questions. So Dr. Gupta, I think this was really an outstanding presentation. Really thank you and everyone else from StatCan who joined today for the presentation. This will be recorded, and I don't remember if